Well, since it's 12 o'clock, we'll go ahead and get started. And I'm going to begin with the Removable Partial Denture program, which has been out for the last couple of years. And its real purpose is to provide a comprehensive, in fact, an exhaustive series of information related to removable partial dentures. It has everything that we could figure out has ever been published relative to removable partial dentures. And what I want to do is show you how this would start and how this program functions. And before I start that, I hope everybody is safe and healthy. We're all struggling at this time. The School of Dentistry here at Loma is closed except for extreme emergency care. And of course, I'm on self-quarantine at home. So let's open the program to begin with. And when you open the program, you can see up on the top taskbar, there's table of contents, image gallery, animation, and video gallery. And I want to start by showing you the 3D RPD program, because removable partial dentures, in most students' mind, is either equivalent to occlusion or slightly less confusing than occlusion, but it's one of the more difficult programs, concepts for students to understand. So I want to first of all begin with this 3D RPD program. In fact, this is where I begin the process of education. I'll spend a good bit of the very first period in class in this program before I've talked about any terms or anything relative to removable partial dentures. I want to have the students understand how a partial denture functions. And so what's in here are a series of removable partial dentures. The first two have the bases present and the teeth. The others are just framework, and then in fact there's some casts in here. And a good friend of mine, the dean at the college in Dammam, Saudi Arabia, helped to fund the initial portion of this program. So that's why it has the developed in collaboration with them, because they were gracious enough to find some funding. So I'm going to start with RPD and cast A just to show you how this is. So what comes up is a cast of a maxillary arch, Kennedy class 2. And I, of course, don't discuss that to begin with, but you can take and zoom in on this as you would like to and rotate it around. So here's where I start with the students. You can take this slider bar and you can take the removable partial denture and you can seat it onto the cast, or it could be the patient's mouth. And I tell them removable partial dentures function best when they go in and out along only one pathway. And of course, we know there is such a thing as a dual or rotational path, but I don't even mention that to begin with. I want them to understand that a partial denture comes in and out along only one pathway, that it stops at a very specific point. And if we were to turn off the removable partial denture, then you can zoom in on any of these casts. And I say, look, there's some funny notches that have been placed into the teeth. These are little kind of straight, slight curve to this one. There's a slight depression in this in the second molar in the distal surface. And that's where the partial denture fits into and in fact stops its motion. And then I also mentioned to them, take a look at this. There's these little wires that run around the tooth. And there's one out here on the facial surface that when the partial denture goes to place, notice how it flexes over the contour of the tooth. And yet there's one on the lingual surface that doesn't flex at all. And then we can turn off the cast and also then start looking at the removable partial denture. And I said, notice that there's a metal framework here, and attached to that is some pink plastic, some resin with some denture teeth present in there. And if you notice, the external surface of this framework is very highly polished, and there's a nice smooth transition between that framework and the polished acrylic resin. But the interesting thing is, if we turn this over and we look at the inside, it's not highly polished. And this gives you an opportunity to talk about, why wouldn't you polish the internal surface? And the same way with the resin. And also, if you rotate it further, then they'll notice that the inside of the clasps or these wires are not highly polished. And I take it even one step further, because in the eHuman occlusion program, which we're not going to be talking about today, there's actually a section on chewing and swallowing. And during that, there's a video in there, a fluoroscopic video from a long time ago that a researcher in Sweden was gracious enough to share with eHuman. And it shows the powerful tongue muscle pressing up against the roof of the mouth. And then in a wave-like motion, the top of the tongue forces the food back as a person swallows. So I'll actually show them this little rim that's around here, this little bit of metal, that actually puts a little bit of pressure, just the right amount of pressure, into the soft tissue in the roof of your mouth or the palate, and that prevents this food from getting wedged underneath. So there's all sorts of opportunities to expand the basic knowledge here, should you choose to do that. So then we can put the cast back in place, you can seat the partial, and then you can talk about any aspect that you would want. But I wanted the students, first of all, to understand how a removable partial denture functions, that it attaches to these teeth, it rests on some teeth, it actually engages the teeth with these little wires, and then you can go down the road of introducing them to some of the terms that we would use. And that is, if we put this take the partial denture off, then you can show them that actually there's a flattened surface on the distal aspect of this second molar. And that flattened surface is called a guide plane or guiding plane. And that's what helps guide the removable partial denture to its specific position, because it has to go to a specific position so all of the parts of the partial denture function as we would like them to be. And then you could even show them the inside of the removable partial denture by rotating it around, and show the flat metal surface, the proximal plate. And you can go through then the different terms and things that you would use in order to describe this particular partial denture. Now, everybody in removable partial dentures has their favorite type of partial denture design. So we've tried to satisfy that by having a series of different designs in here. So for instance, this particular one, if we go to this particular one has an I-bar class, same as the partial denture A, but it has an I-bar present in it. And then there's other designs in here that we can take a look at. And you can see here's a one with cast circumferential clasps and a lingual bar. And there's a variety of different designs, so that if perchance somebody wants to only focus on one particular design, they can do it. And for instance, here's a I-bar type of design. So if we put this to place, and then you can see that the I-bar contacts the entire distal surface of the tooth, so you could get into the fact that this is a Cradaville type of design for the I-bar assembly. And then some people have chosen to take their extra rest indirect retainer and have a perforation in there for a variety of different reasons. So that's present on this particular one. There are different types of mesh designs for whatever you want. And in fact, for those of us that know a little bit more of the details of removable partial dentures, there are defects in every one of these designs that I don't get into at the beginning, because I'm trying to make sure that they understand the principles. But there are defects in here that eventually can be pointed out to the students. And for instance, in this particular design, you'll notice that the minor connector coming up to the mesial rest on this assembly is actually touching the tooth in front of it, which would then prevent this clasp assembly from releasing from the tooth. So if you study that, you can use that later on in the course for some very interesting presentations and discussions with the students. This being online, you would be demonstrating that to them. You could give an assignment, for instance. Take a look at RPD and CAST-E after they understand the principles of design of this particular type of clasp assembly. And you could say, okay, what do you notice here that doesn't meet the criteria of the ideal design? So that's one thing in there with that particular assembly. And then there's another one here you can see that actually goes on, and it has a design that would be very much different. There's a plate in here, so you can start talking about the distance from, later on in the course, you could talk about the distance between the marginal gingiva and the floor of the mouth, how much space you would need there for all the different components, and the numbers that we often present to the students as far as, keeping the lingual bar on a mandibular major connector 3 millimeters, or some people would say 4 millimeters away from the marginal gingiva. How much height do you need in the major connector itself to be sufficiently stiff? And there's a RPI design, there's the I-bar design, the RPA design, and there's even this particular design here that shows a wrought wire clasp. And this one, in concert with what the literature has shown relative to maintaining continued flexibility without breakage, this wrought wire clasp is soldered back away from the location of the clasp tip, soldered to the framework. So again, these all function the same way, with the clasp flexing over the tooth and the partial denture having various types of designs, so that you could pick and choose and discuss what you like about it as an educator, what you don't like about it, because everybody has a preference for removable partial dentures. And so that's been the attempt of this program, to satisfy that particular aspect. So with that in mind, you can see there's a lot of things in here, a lot of different examples. In fact, there's casts in here where you can see the guiding surfaces. You can even superimpose the two teeth over each other to show that there were guiding surfaces placed into this particular cast. And let's see, let's look at another one here. And you could see, you could talk about even showing this to a student if you were to have then a mesial rest seat in these particular teeth, and you had a distal guiding plane that only encompassed the occlusal aspect of it. What type of a clasp assembly would this be suitable for? So these make for great questions, and I'm just trying to give you some ideas of ways that I have personally used this in helping to teach students. So now, with that 3D RPD program in mind, let's go back to the table of contents. And in the table of contents, there's 8 sections, including the introduction to removable partial dentures. And this basically is an evidence-based review of all of the content that would be pertinent to that particular topic. So if you looked at introduction to removable partial dentures, that section has a little historic perspective on removable partial dentures. It has the indications chapter. It has classification systems. So you can go in here, and each chapter begins with some highlights. This would be a very brief synopsis of the key information that's present in that particular chapter. And so just let me familiarize you with that. Each of the pages is numbered, so you can see that this is chapter 3 in that introduction section, and this is page 1. And then you can click on this little caret that points down, and this shows you everything that's in that particular chapter, so you could navigate through that. So if you wanted to look at Kennedy's classification system, you would go here, and then it would describe those systems, as well as have references that you can click on that would show where this information came from, such as 1923. And then there's the different figures that you can bring up. You can click on the figures in the right-hand column that would describe that for you. And by the way, I actually, at the end of the course, I take these exact pictures because you can do a print to screen, and you could then project that to the front of the class. And we have students come up in groups of 3 and in front of the class actually draw and design the framework of their choice. And then that gives us a good discussion opportunity for this. And what you could do in an online environment is, again, have the students design their removable partial dentures, email to you the design that they've drawn on a particular picture like this. And then you can have sessions where you discuss with the entire class this particular design. And I've always tried to do that in a non-intuitive and intimidating manner so that the students feel very comfortable. They come up, there's no mistakes. We just talk about, okay, how could you have designed it differently? What's with that? So that's interesting part of this, because there's a whole series of these pictures that take you through the different classification systems. And then as you go down through the text, again, you have the opportunity then to click on the picture when you want to, or you can click through it in the column at the end. And then you can go through the pages. And what you'll see here is the opportunity to give an assignment ahead of time to the students. And of course, we have each student has a copy of this downloaded onto either their computer or their tablet. And that way they're given an assignment, and we specifically do it. We'll say introduction section, chapter 3, pages 4 to whatever it is, because you'll see as I go through here, there's page 5, and then it's got Applegate's rules. So you don't have to cover all of the content in these chapters. You as the expert can take a look at what you want the students to cover, and then you go through that and cover that during the class period and online program. So this lends itself to whatever you want to make out of it. There's Applegate's rules, the Applegate-Kennedy system. So again, go up here, you can see, and there's, of course, this went on further into a maxillofacial classification system, the implant classification system, implant corrected system. So there's material that you probably wouldn't want necessarily the students to have to be assigned to. What has intrigued me the most is we'll give assignments to students, and then we'll go through that material. And it's always interesting to have a student ask a question about material that was not assigned to them, meaning that they've actually gone ahead and read some things that were a little bit more advanced for them. So again, this is meant to be completely comprehensive as opposed to being just dental student level, because this really has material at all levels. So again, going back to this introduction system, then there's an introduction to the various components, and I won't go through that with you. Now in this section, again, I won't take you on a journey through all of this, but this is all the evidence-based information that we could find in the literature. That is, there's a series of articles about patient satisfaction and quality of life, how removable partial dentures affect that. There's the impact upon periodontal health. There's the whole shortened dental arch concept, where we don't replace some of the posterior teeth. In fact, we don't make then a removable partial denture. So that's all there. And then patient usage. What's the data show on removable partial dentures that are made? How many of them are actually used? Factors affecting success and failure, and we go all the way down through here. So this is a portion that has some great content to present the science to students by very specific reading assignments. Now, the foundational concepts, this is kind of the introduction portion that I consider to be quite important. So we have the students go through the essential characteristics of RPD function. So you can go in here and then you can see what this section has in it. And it's really just a brief. It's just an introduction and it talks about the 10 guiding principles, and just as an introduction, leading them into the, the portion that would be the 10 guiding principles. And there's a section on dental surveyors and the surveying of casts. So let me take you on a little bit of a journey through that, because it has some very nice animations that were made. The introduction, and then it typically shows you all of the components of a surveyor, which is nothing exotic and new. And then the purposes of surveying, again, you can see these are all just figures, but then we get down to some animations. And these animations were made simplistic, so somebody, you could talk about this, showing the use of an analyzing rod and how you would run that around a tooth to identify the height of contour. It could, of course, be marked. And then comparing the two teeth, looking at them and seeing what surfaces would need to be modified if these were natural dentition. So again, there's a series of these different ones that are in there to show a specific, building on some information. The first one just showed them how to use that, and then it shows the simplistic animation of the undercut gauge coming into place and actually being measured a distance below the survey line. So we have a whole series of these throughout the process in there. And then in the foundational concepts, the 10 guiding principles. Again, if you look at this, you can see that's what we put together as considered to be important aspects of a removable partial denture, providing guidance, support, retention, reciprocation, rigidity, stability, passivity, minimizing components by metal components, maximizing mucosal coverage by the base, and then restoring the anterior edentulous spaces rather than having a modification space. So again, that's all the principles, and they're provided in pretty good detail to show everybody what it is and the different processes that are present. Again, with animations to support this process, to show an animation of a guide plane and then the proximal plate contacting that. So you can take again, decide what portions are most important, assign that to the students. And what I would just propose, as I've done with this, you give the students an assignment, they come to your online presentation, they've already had to sign in and take a quiz on the information that you assigned to them. And then following that, them taking that quiz, then you can go through and review with them whatever you feel are the most important aspects of that particular assignment. Again, using the animations, using what's in the program to your benefit, and looking at all of this and seeing what it is. And then there's different things you can see. For instance, there's a picture of a proximal plate going all the way down and contacting the gingiva as Cradaville was recommended. And then there's the design that Kroll recommended, where you have a 2 to 3 millimeter guiding surface, guide plane, and then the proximal plate only contacts the apical millimeter of this. So whatever is the particular philosophy that you prefer, that's in here and discussed, as well as demonstrated with animations. Now going back to this, and then this is really pretty extensive. Certainly not something, I don't start out with this. What I actually do in the class is spend a good bit of the first period in the 3D RPD program, and then start the process of the classification system, and then looking at components, and that spills over usually into another period. So they understand the basic how a removable partial denture functions. Here's the classification system. Here are the different components that then make up a removable partial denture. Once they do that, then I spend two class periods, 2 online sessions with the 10 guiding principles. And then this would be for later on, because here are an extensive list that Dr. Naylor and I tried to go through everything that we could think of that would be important in the guiding plan. So these 50 guidelines are listed here, and it's interesting to go through that so you can agree or certainly disagree with all of these. We've tried to reference the ones for which there were references available in there. And this would be all the most important things in a comprehensive type of a look at removable partial denture design. Now, in the components section, we have here typically all the individual chapter on each of the major components of a removable partial denture. So you could take a look at that and decide which was what you would like to have. And for instance, in the major connectors, you can see that there's mandibular designs, all the different ones that are present here. And that goes through a whole series of things. And then maxillary major connector design. So we think most of the major connector designs that have been talked about and the rationale behind them is all present in that particular section. And then there's minor connectors, rest seats and rests. And then in clasp assemblies in here, you can see this is, again, more exhaustive than what would be necessarily needed for dental students, but it has everything. It has cast circumferential, reverse circumferential, cast wrought, bar clasp, Cradaville, Kroll, RPA, reverse RPA, and it goes all the way down to some less commonly used, but still useful type of clasp design. So that's all in here for whatever it is that you felt like you needed to cover. And I want to just show this coronal contours, because I found in teaching students that sometimes they didn't understand the different designs here. So if you look coronal contours for clasp assemblies, in here, there are pictures that take you on a journey. And these are great ones to just simply quiz students. For instance, to bring this picture up and just ask, we look at it, we know it's a cast circumferential clasp assembly, but you could have that picture and you could have the person identified. So there's the picture. Now, corresponding with that picture is this picture that would show ideally how you might want to machine a tooth or have a crown fabricated with the contours that would support that particular clasp assembly. So this is a very useful section. And it has all the different types of assemblies that we've talked about and listed previously. So for instance, there would be the Cradaville I-bar clasp assembly, and what it would look like when it's attached to the teeth, and then the actual process by which you would machine the teeth in order to create this type of contours on the natural teeth. And then again, the Kroll assembly, which is again another very popular clasp assembly, what it looks like on the teeth, have the students identify. And these have all been carefully drawn so that the minor connector doesn't touch the tooth in front of it to try to follow the philosophy. And again, these pictures. And you could actually take this, print the screen, and assemble this together as a wonderful handout for the students to show them, here's how the different teeth for the clasp assembly that you're particularly emphasizing in your teaching, that's how that would work best. So let's just go back again. Now there's a section on occlusion. This is a general thing that just covers occlusion, occlusal relationship, occlusion and occlusal schemes. And that's specific to removable partial dentures. And then there's a section on articulators and recording methods. This would really fit anything, because if you look in here, there's the classification system of articulators. And the best I could figure out, it has virtually all of the articulator brands that we could find that would be commonly used in prosthodontic education in different parts of the world. This would have those, and then you could click on any one of those, for instance, handout, and it describes all the different models, the characteristics about them. So again, you could assign a page for whatever articulator you happen to use, and then have the students go into that area. Then materials. There's a section here on all of the materials that would be commonly used in removable partial dentures. So this is kind of a dental materials, mini dental materials textbook that has all of that information just to acquaint you with it. And then there's this massive section, I call it the really key section here, that takes you on a journey through the clinical and laboratory procedures, beginning with diagnosis and treatment planning, to making impressions, interocclusal records, diagnostic cast analysis, modifying the natural teeth, making secondary impressions and master casts. You can go all the way down through this. And so, for instance, with making secondary impressions and master casts, you can go through here, and it'll just talk about the master cast, the characteristics of an ideal impression material, impression tray coverage. It shows for a variety of different stock and custom trays depending on what you're having the students do for their particular process, as well as the materials involved, types of materials that could be used for making secondary impressions. And it goes through each one of these, the advantages and disadvantages. You can see all the different types of materials, including the elastomeric materials, and then actually the technique of making this using the different types of materials. So this goes all the way down through the entire process for making and using all the clinical procedures related to removable partial dentures. So again, it would be your job to familiarize yourself with the content that's in this program, and then give the students a specific assignment. Go to section 6, chapter whatever it is, and here's the page numbers that I want you to cover, and then we're going to quiz you on that. You can take then that material would be the nucleus for your examination questions. And then there's a clinical placement and post-placement care. So in the clinical adjustment section, again, synopsis of all the key information you'd want a student to know about that in the chapter. And then it's just talking about, there's a lot of pictures here that show a removable partial denture and the smooth transition that you'd want to have between the metal and the resin base. So you go through this again, looking at, here's the content that would be in there, the sequence of procedures, the framework fit, the denture base adaptation, the border evaluation. And in here, of course, are the different methods that have been used with this. And of course, very popularly, you have the pressure indicating paste with a suggestion that if you use one of these flux brushes for applying flux for welding, that it be cut in half so that it has the bristles are stiffer. And that allows you then to put on a finer layer of this for optimal evaluation of the fit of the prosthesis in place. So it has all of that information and different ways that have been used to evaluate the fit of the prosthesis. And then there's a section on relines, rebases, and repairs that you can see here. And again, the 3 key questions when you're trying to determine what's done in this terminology and things, which you don't necessarily have to go through all of this, but this is a great section on indications for a reline, what you'd want the student to be looking at. Great place to derive questions, the clinical exam procedures, and the criteria for determining when you need for a reline. So here, as we know, you would push down on the base, and of course this shows some movement there that would have the minor connector rising up and indicating that a reline might be needed. And then the types of relines, impressions, materials. the indirect process, and eventually you get down to the actual techniques here. And this just shows a the method for doing a heat processed reline material, the way the resin is mixed, and then the separation of it and the actual finishing of the reline. So that's in here. And then there's the laboratory jig reline procedure. So whatever you're using to teach the students, it's contained in this section. And the last thing I want to show is in this design options. Now, this is, again, a section that a lot of people wouldn't necessarily get into, but you could as an advanced course portion of the course, because here are the implants supported and retained removable partial dentures, the rotational path partial dentures. So this one would give you some introduction, indications for use of implants, and then the literature review related to quality of life and patient satisfaction when they have this type of procedure. And then implant survival data and prosthesis complications, the effect of location on the implant, the effect on chewing, bone changes over time, cost effectiveness, laboratory study of retention. And then there's a series of clinical examples where removable partial dentures have been used because of either designed to start with, or the abutments were lost, and then there was a retrofitting in order to make the removable partial denture now maintain its support. So this would be the sections here. And there's one on swing lock removable partial dentures, resin bonded retainers for that. Rotational path is in here. So you could discuss this quite interestingly. And there are, again, animations that would show how this type of a design would be created if you had this particular type of a rotational path design. And then this one going from anterior to posterior with a rotational path of design, so you wouldn't have any clasps visible in certain teeth. The disadvantages, and then the classification system, all of these things that were done, how you would survey and analyze in order to design a tooth to determine where the different assemblies would be placed, and abutment restorations. You can see, again, all of this, and I want to get through to clinical examples because I, of course, had a few myself, but Ted Jacobson was very gracious to contribute some examples also that you can see here, where they would have been long-term results. And as you can see, figure 61, there's 20 years of follow-up, and 15 years and 10 years. So you have some great examples of long-term use of these particular type of designs. Now, just to finish up this program, there's an image gallery, so you can go into any particular chapter that you were interested in. For instance, if you wanted to see, okay, what's in materials, what's in the impression materials chapter, as far as that, you can see then all of the pictures. So there's that, and there's then an animation and video gallery that's present for all of these different types of each chapter. So there's all of the animations and that are related to clasp assemblies. And so each one of these clasp assemblies has a description of it and an animation along with it.